appointed Additional Chief Secretary Ma'am, PDT and HSP, and Director NHA, and our DME, and all the teams, Joint Director, DHOs, and all the representatives from all the councils, and also the officials from DNHSP and the CM insurance scheme. Thank you very much for the opportunity to be here. In fact, this is one of the, as mentioned by our PD, this is one of the biggest interventions which is need of the hour. See, without this digitalization, definitely we cannot move forward. And with Madam's keen interest in pushing this digital movement, this is the right time we'll all join together and take it to the next level. See, let us clearly understand that digitalization alone will bring you the so-called the efficiency, inclusiveness, collation, repeatability, whatever you call it, this is all possible only if you do a digitalization. Otherwise, having a separate data, manual data, whatever it is possible, still it will not achieve the ultimate aim of delivering a correct, specific service at the required point of time. So that is what we call it as a digital health platform. So once we create this digital health platform, see all those different things which are happening now, either vertically or whatever it is, we can horizontally connect with everything and connect with the community. These things will happen. But இது எல்லாமே நம்ம மார்னிங்லேருந்து பேசியிருப்போம், we all know it, but unless otherwise we understand from a beneficiary point of view, you will not understand the value of it. See, we all mostly as a provider, we see from our side only, but if you see from a beneficiary point, then you will understand where are the gaps. So, வழக்கமாக நம்ம இந்த ஸ்டோரி மாதிரி சொல்லுவோம். See, if you go as a patient, you will know that there will be a huge crowd, we may not have the data, past record இருக்காது, என்ன மெடிசன் எடுத்துருக்கோம் தெரியாது, we need to move around, டெஸ்ட் பண்ணியிருப்போம், ரிசல்ட் தெரியாது, and follow தெரியாது. See, இதெல்லாம் நம்ம சால்வ் பண்ணோம்னா we need to have a step-by-step approach as a beneficiary. See, நம்ம எல்லாரும் என்ன பண்றோம், அப்பாயின்மெண்ட் வேணும்னா we should know when, where, which place, which specialty, what time. இந்த clear information இல்லைன்னா we'll be simply going and standing in the wrong doors. That also many times appointment வாங்குவோம், but the message may not come to us or message may not reach the facility. So இந்த மாதிரி ஒரு சின்ன கேப்ல there will be disappointment. And past history கேட்போம், we all know, even medical doctors, we may not know what has happened few years back and what was our 3 years visit or the lab results. இதெல்லாம் வேணும்னா the only way is that the information should be available, which should be retrievable, and it should be authenticated with a unique ID. See, unless we are very specific about our data being stored specifically with our concern and shared, things will not happen. So this is where your digital mission, this is where your ABA ID is going to play a role. We are trying to create a similar to infrastructure, we are trying to create a infrastructure. This infrastructure will facilitate all the required things. Ila moonu mattumda நம்ம digital will be very very clear. See, one is that it should be standardized. The standards are there for all the levels. Everywhere there will be SOP and there will be an interoperability. So, எங்கிருந்து யாரோடவன்னா the information should be able to move around and it should be readable, understandable. Finally, it should be very unique to that individual person and it should be secured enough and it should be shared only with the concern. See, இந்த மூணுத்தையும் நம்ம என்ஷூர் பண்ணிட்டோம்னா the digital movement between different levels, அது லேபாக இருக்கலாம், ஃபார்மசியாக இருக்கலாம், big hospital, small hospital, GP, corporate, whatever it is, all these things can be done. This is what exactly this ABA or NHM or ABA mission, National Authority, whatever is trying to do it. இல்லை 2-3 மட்டும்தான் we are again and again focusing. One is you are giving an unique ID to the individual citizen. See, இப்போ நிறைய ஐடி இருக்கு இன்க்ளூடிங் ஆதார், பட் இட்ஸ் வெரி டிஃபிகல்ட் டு ஷேர் ஜஸ்ட் லைக் தட். ஸோ அதுக்கு தான் இந்த அல்டர்னேட்டிவ், த சிமிலர் 14-digit ஐடி விச் இஸ் லிங்க் டு யுவர் ஆதார், பட் இட் கேன் பி ஷேர்ட் வெரி வெல். இது ஒரு பார்ட். செகண்ட் இஸ் தட் யுவர் ஹெல்த் ஃபெசிலிட்டி ரிஜிஸ்ட்ரேஷன். இப்போ நமக்கு கிளினிக்கல் எஸ்டாப்ளிஷ்மெண்ட் ஆக்ட் இருக்கு, அவர் டிஎம்எஸ் இஸ் இம்ப்ளிமெண்டிங், பட் ஸ்டில் தெர் ஆர் வெரி மெனி ஸ்மாலர் பிளேயர்ஸ் அக்ராஸ் ஆல் எவ்ரிவேர். See, if a lab, there are very, very small labs which will function only as a collection center, but still we need those details. there will be so many general practitioners. There's so many formal and informal practitioners. The facility registration can be done, and as said by our PD, we are much behind rest of the states in the country. But once we are given a thrust, definitely we have a capacity to move on, that we should do it. The second is your health personnel. So health personal registration. The health personal registration could be your doctor, nurse, whoever may be the provider. According to the qualification, according to the council norms, it should be registered. Automatically your deploying and following up your health solutions is very simple. There are many other things which are related, which we need to integrate with this. See, the basic individual registration, facility registration, personal registration. But there are many more things to it. See, for example, we need to understand about insurance. We need to understand about financial issues. We need to understand your lab information system. We need to know about your pharmacy and the movement, your logistics. See, all these things have a bigger role to play in healthcare delivery. See, there are different components, but there is a way in which all these things can be integrated by following this digital system. Finally, from public health point of view, which 2-3 things are very, very critical for us. See, one is your data. See, the bigger the data, very useful, and we can put on many other tools like artificial intelligence, machine learning, big data. We need to have a bigger and bigger data. Once you start analyzing it, what you know is your patterns. What you know is your risk profile. The profile we can definitely start intervening at a little more earlier level where we can talk about prevention, and also after intervention we can really understand where we stand. The same data will be useful for us in understanding the gaps. Underserved area, underserved population, we can able to pick up, and also the gaps in implementation we can able to pick up with this data and data visualization. This is another area, and if you are able to do it, doing a remote diagnosis or remote treatment also possible in a digital structure. And finally, what you all should know is that public health is one department where everything is very close to the community. We have a better reach to the community than anyone else. We can very well reach roughly over 5 crore citizens reach pandrathu. It is within our possible limits only. See, imagine you have done 12.75 crore COVID vaccination in 1 year time. See, capacity when all of you are putting your effort together along with the private sector, this numbers is much reachable. And getting all the facility, getting all the individuals in the system with the council's help or IMA or ICHF, definitely we can do that. And what is 2-3 things which is critically needed, that we need to have a development partner, we need to have an interfacing agency, for which already the NHA, they have a provision for it. We need to use it both at the district level, state level, we can definitely move it forward. And another thing is you are creating the interest in the community. That is how we are going to engage it, how we are going to put this message across them is very critical. For that also there is a suitable provisions are there in the both the digital mission, where we will encourage the people to come and do it. There are many mechanisms which we can do it. Even our routine OP, where almost 1-2 crore OPs are getting registered, we can very well tap this, and we already have almost 1.8 crore non-communicable disease patients line list. This we can tap it. And when we have done a COVID vaccination in a UVIN portal, almost 6-7 crore data is already available. This we can use it. There are many options we can do it. And the experience which we piloted in Krishnagiri is also a very good experience, which Ramesh or other whoever presented, they can able to present it. And finally, when everything is doable, still we want to do it as a pilot, which we call it as a microsite, where all those players, whether it's a smaller one or a bigger one, will put everything together and make it happen. If this is done, definitely our initial goal of equitable distribution, efficient delivery of services, all can be done. Thank you very much for the opportunity. Thank you.
And we are talking about, today evening, we are talking about the digital interventions. I want to ask a question to all of you. How many of you are using Alexa? Can you just show me your hands? Alexa, how many people are using? Many people are using. How many of you are using Chat GPT? I can see so many hands. See, in our daily lives, now we cannot think about our daily life without technology. Am I right? When you want to order some food from Zomato or from Swiggy, or you want to travel somewhere and you are asking for a taxi, you are booking a cab, or you are using, we were just talking, me, Arun, DPH, we were talking about using very simple apps. For example, to book a doctor, Practo. Isn't it? It's all technology. And what technology it is? Alexa, for example, or Chat GPT, they're all artificial intelligence based systems. There are so many systems which can recognize your voice. Even in Chat GPT, you can actually speak, upload, and it will give you the answer. Correct? I want to know, there's some people who did not show their hands up. Why you are not using any of these? I want to ask you. There are many people who did not raise their hands. Can we have some response? Why you are not using either Alexa or Chat GPT or any of these softwares which can make life so much easier? Can anybody tell me, share their experience? Are you hesitant? You think it's technology. It's very complicated. I can't use it. Andamari irkuda. Do you think that there are some areas where you may not be able to? Isn't it? Am I right? There is nothing to feel bad about it. There's nothing to feel bad about it. There are millions of people who feel very hesitant to use technology. In this group itself, there will be many people. There is nothing great about using technology, and there is nothing shameful about not using technology. There's nothing to be shameful about. But the point here is the technology is just a tool. It is just a tool to make things better. Now, how easy it is for you to just play a music, listen to the news, know about weather, just by calling Alexa. And Alexa recognizes your voice and you get everything. There will be a day, you mind my words today, there will be a day when already, maybe it is already happening, when artificial intelligence will make sure that even the most complicated of surgeries that we do, you are able to do in the absence of a doctor. I don't know how many of you recently saw the news where in China, a Chinese doctor performed a very complicated surgery sitting 2,000 miles away. Did you notice, some of you, did you read that news? It was a fantastic news. I watched with so much of awe. Sitting 2,000 kilometers, he operated that surgical machine and operated on a patient. Actual operation was done by the doctor using artificial intelligence, machine learning. I will finish with one more example. Now, when we are saying climate change, health, and COVID, it came because of the human and animal interaction. Mpox, we are talking about Mpox now. Every now and then there will be some disease. Just imagine a world where you do not keep a repository of data, where you do not have a network of professionals. In today's world, when we are able to find that in African continent you have mpox, how information is coming to you, correct? Within no time, within fraction of seconds, you know, you have thermal cameras to screen people who are coming from the airports. You go to many countries, you don't need any immigration. You just pass through you show your passport and you can pass through the channel, but it will still find out if you have fever, if you have sore throat, if you have rashes. It is not possible if you don't have technology. In climate change, we are doing a modeling for next 10 years. What is the modeling? How in Rajapalayam, after 10 years, water bodies will be. How much rain will be there in Rajapalayam after 10 years? Whether there will be a drought after 10 years. This is what technology can do. In the modeling namakku venu. In the modeling irundada நீங்க plan பண்ண முடியும். You will be able to plan your health facilities, your water scarcity plan, your all other components, whether it is agriculture production, everything has to be planned on technology. So with these words, I would urge all of you, all the DDs and JDs are here. Though there are so many other topics I want to talk to you, but we will have that review meeting some other time. But please go back to your districts. And Arun is here and he will make sure, because he is somebody who is a go-getter. I want to thank him for organizing this wonderful program. It's totally his initiative and we must give him a big hand. Totally his involvement and totally his leadership. And I'm very sure the kind of work that he's doing, I am very confident to tell Vikram, you will come back with a lot of pride, saying that please go and visit other states like UP, Karnataka, Andhra and Tamil Nadu. Nandri Vanakkam.